Hi, I'm Vivian Williams, and I'm here to give a tour to new patients in the Mayo Clinic Department of Neurology so they know what to expect when they get here. Now, the Neurology Department is located on the 8th floor of the Gonda Building and the Mayo Building. I'm in the Gonda Building right now, and the Mayo Building is just down that hallway, so you can go back and forth between the buildings without having to go outside. The Neurosurgery Department is also located on this level, so if you have an appointment there, you'll come to this location as well. When you get to Mayo Clinic, you want to make sure you have some things with you. You want to bring your list of medications, you also want to bring any pertinent records, and you want to bring a book or something to do when you're in the waiting area, which is where I am right now. There's also a wireless internet service if you bring your own computer, and if you didn't, there's some computers that are set up for you to use. There's also a television. So now that we're here, let me show you how to check in. When you check in, you can give the person behind the desk any information that you might have brought with you. Also, they can give you paperwork if you have to fill something out while you're here, as well as a pager. So when you get your pager, you can have a seat in the waiting room, and when it goes off, they'll be ready for your appointment. I want to make sure you realize that at this desk, when you check in, you're not checking into the hospital, you're just checking into the clinic for your appointments for that day. When your pager goes off, a clinical assistant will meet you at the door. Thank you. You're welcome. And they'll also ask you your name and date of birth to make sure they have the right patient. And this is an area where you might have your vital signs taken, but you might also have them taken in your exam room. I'm going to tell you a little bit about the pager because you're going to be keeping it with you the entire time in case you need to be called for a follow-up. And also, there'll always be someone escorting you from room to room, so you never have to worry about finding your own way. This room is where physicians have an opportunity to review your records before you get here, any lab tests or images, things like that. And this down the hall is the exam room where we're going to be going today. Once you get into an exam room, you're going to meet with a clinical assistant like Michelle, who's with us today. And when you meet with someone like Michelle, they go over your medications, any allergies you might have, or information from referring physicians. Now, in the exam room is where you're going to meet your doctor. At Mayo Clinic, we have a team approach, so you might be seeing a resident, a fellow, a physician's assistant, perhaps a nurse practitioner, but you can be assured that you will always see a Mayo staff neurologist while you're here on your first visit, and also that staff neurologist will be overseeing your care while you're here. When you're done with your exam, a clinical assistant will help you schedule tests or any additional consultations your doctor may have ordered for you. Now, they'll work around your schedule to do this, so if there are specific days of the week you want to come in, that would work. They can help you figure that out, or if you want to get them done as soon as possible. But those clinical assistants are here to help you get that done. While your tests are being scheduled, you can wait in the waiting room and your pager will go off. That'll let you know when your appointment schedule is ready. And a clinical assistant will have that waiting for you at the desk here. And on the appointment schedule, it will have the time, the date, and the location of each test. Also with this schedule is a list of instructions. So if you have any special instructions, like you have to fast before a test, or just information about that test, this pamphlet will have that information for you. Now, some of your tests might be on Gonda 8 on this floor, but others may be in other areas around the Mayo Clinic complex. If that's the case, there's an escort service that can help you get to those locations. There's also people manning information booths throughout the system, so it's easy to get where you have to go. I want to make sure that you know that when you're making your appointments for Mayo Clinic, you want to schedule about 5 to 7 business days because it can take that long to get through all these tests. Doesn't always, but it can sometime. And if you're here and you realize that you have to leave earlier, there's a process that you can go through to hopefully move those appointments up to accommodate those needs. And once you're done with all of your testing, you will have another appointment with your Mayo Clinic staff neurologist. During your summary visit with your Mayo Clinic neurologist, you'll go over any tests or recommendations that they might have, and also you'll have an opportunity to ask questions. All of your records will be sent back to you as well as to your local healthcare provider. Your Mayo Clinic neurologist will partner with your local healthcare provider to provide ongoing neurologic care.